Hello and welcome to 12 to Your Health. I'm your host, Dr. Derek De Silva. More than 30 million women in this country over the age of 45 suffer from pelvic organ prolapse, which means the organs of the pelvic area move from their normal positions. It can cause a whole range of problems. One of the traditional courses of action for women needing surgery is a radical and invasive hysterectomy. But a new, less invasive procedure is making it possible for women to avoid that and retain the option of childbirth. Here to tell us about and how it works is urogynecologist Dr. Michael Ingber of Morris Urology and St. Clair's Health System in Denville. Welcome to the program.
Thanks for having me on.
Thank you very much for joining us. Pelvic organ prolapse, what is that? What's going on there?
Well, pelvic organ prolapse represents essentially a hernia in the pelvis, and there are several organs that can be involved. The most common can be the bladder. The rectum can be involved, the uterus can prolapse, or in women who have had a hysterectomy, the top of the vaginal scar can actually fall out and prolapse.
So the word prolapse means what?
The prolapse essentially means a hernia.
Or a falling?
Correct.
All right. What are some of the risk factors for women when this happens?
Well, we know that 1 in 2 women over the age of 45 suffers from some type of prolapse, and most common risk factor is age. Menopause can be one risk factor, obesity, and very commonly after having vaginal deliveries, women can have prolapse.
Typical symptoms of women that have this condition?
Symptoms vary. A very common symptom is feeling an uncomfortable sensation in the pelvis or a bulge sensation. With the prolapse, depending on what organ is prolapsed, women can have bladder problems, they can have bowel problems. So any number of symptoms can represent prolapse.
So if left untreated then, are those the things that happen? What typically goes on?
Well, most commonly, if left untreated, women can suffer. It's more of a quality of life issue. Occasionally, people can have bladder problems, urinary tract infections can be caused by prolapse, and constipation can be caused by prolapse.
The traditional treatments, typically what are they?
Well, we have both abdominal surgeries and vaginal surgeries that we do. And there's also non-surgical approaches in the form of something called a pessary, where we can lift the fallen organ back in place.
I mean, I know in the introduction I mentioned that women over the age of 45 want to retain the ability to, perhaps to have another child. But is that an issue for women over the age of 45?
Well, it can be. Some women do want to retain their uterus for childbearing purposes. Other women feel that their uterus is a part of them. And certainly there are reasons that women need a hysterectomy for fibroid tumors or bleeding purposes. But for prolapse, our studies show that it's not necessarily the case.
So what's this new procedure? Give us the skinny on it.
Well, in the past, and even now, the majority of hysterectomies are being done through an open approach. 60% of hysterectomies are done through a large abdominal incision, and we have technology now.
And here's what, can you just tell us what's happening here?
Sure, so this is called laparoscopic single-site surgery. So we use a special abdominal access system where we can essentially make a tiny hole in the belly button and essentially do the same abdominal procedures through a scarless approach. So this is showing insertion of our access device. And I was fortunate enough to train at the Cleveland Clinic, where a lot of these devices were innovated. And through this access device, we're able to put our instruments and do the same surgeries that would be done through an open incision. Or
now I'm being told that you're one of the first ones that's been trained to do this. Is that right?
That's correct.
Okay, so that's 2 feathers in your cap. Tell us what's going on here.
Well, this is after the access device has been placed. You can see there's 3 different ports, those pink ports where we're able to insert our instruments through. So typically with the laparoscopic or robotic surgery, we make 5 to 6 incisions and put our instruments through there. With this approach, we're able to do it through 1 tiny incision hidden in the belly button.
So what about, are the results better? Why is this so? Obviously, it's for obvious reasons, you don't have to open up the belly. But what else?
Well, right now this is very new technology. This just came out from a couple centers around the country. The obvious benefit from using single port technology is cosmetics.
Right.
In the long term, we believe that single port surgery will lead to fewer post-operative problems, less pain, and quicker return to recovery.
Now, we have also some more video, and then we'll show these instruments of how you do this and exactly what's happening. Tell us what's going on here.
Well, this is just showing the new instruments that we have, and we're able to essentially flex our instruments within the body. You can see how the instruments crisscross cross, making an X, and that's the point of our incision. So the traditional laparoscopic instruments are simply straight. They can't do these flexing maneuvers inside. This allows the trained surgeon to, it's almost like having your own hands within a patient's body.
This is just amazing as to what's going on here. All right, now let me just hold this stuff here that we have. First of all, tell me what this is that is right here, and what is this used for?
This is, the general term for this is called mesh. It's made out of something called polypropylene, and we found in the long term when we use something called mesh, it decreases risk of recurrence of prolapse. So in the past we would simply tighten the muscles, and hernia surgeons would do the same thing, and, and our recurrence rates were higher. When we use a synthetic material like this, we're able to have excellent results in the long term.
Okay, so it's a mesh that's real simple. Can you show us this, what's happening with these instruments here?
Sure. So the traditional,
we've got about a minute. So
the traditional laparoscopic instruments, we'd make several incisions and we'd work like this. Nowadays, we're able to have these instruments which actually can flex at the tip, and it's very challenging to the trained surgeon. It's essentially like working like a dentist. We have to reverse our brain so that when I move my right hand, it's actually the left instrument that's moving inside the body.
And recovery on this has got to be pretty quick, right?
The majority of our surgeries, patients go home the same day or within 24 hours. Patients tend to do very well. Again, it's early technology, but it appears to be working very well.
And the long-term recovery, things like that, no issues?
Well, I still tell patients that you know, even though the scar is essentially hidden in the belly button, they still had the same kind of surgery that someone would have through multiple incisions. So they still have to refrain from heavy lifting and straining.
Great job. Thank you very much for this wonderful information.
Thanks so much for having me.
Pleasure to have you here. Coming up on 12T Health, are all statin drugs the same? I'll tackle that question when I answer your email questions. And after the break,